almost all of my experiences in the ER inform continuously what I do as governor or what I did as lieutenant governor. There's just kind of two ways that this has worked. One, for disasters and crises, obviously the emergency room work has been indispensable because we've had several huge incidents or episodes that I could share with you. There's the Maui wildfire, which occurred almost exactly 2 years ago. That was devastating. We lost 102 beautiful people, and the entire community was destroyed. And so being an emergency room doc, I could respond right away. It's just in our DNA now. And that helped. So we housed everybody immediately. Within 13 days, we got everyone into a hotel room for a year, and then we built houses and set up free clinics and the whole thing. So that, I think, helped a lot to be able to make decisions fast.
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, I'm joined by Governor Josh Green, emergency physician, longtime public servant, and now the governor of Hawaii. He's one of the few people in America who I think has worn both a trauma gown and a governor's sash, often at the same time. During the COVID-19 pandemic, he kept treating patients in the ER while leading the state. Now, as governor, he's taking on everything from housing to climate to addiction and public health with the urgency of somebody who's seen the consequences up close. I'm so excited to talk to Governor Green today because he represents what so many physicians say we want: a seat at the table, and not just to consult, but to lead. Governor Josh Green, welcome to How I Doctor. Thank you so much for being here today.
Thank you. Please call me Josh. And I'm just really honored to be a part of the program. I like the optimism and just the overall positive vibe that you give, Graham. It's a important thing for we physicians to remember that it's just a magnificent discipline to be in. With tough days and tough years, I totally get it, but I really like that, and it's been an honor to be a physician and a governor both.
Josh, how many years did you practice before you went into politics?
Well, I've practiced for 25 years. I was out of residency for 4 years when I got elected, and then I stayed in the ER all the way till I was elected governor in 2022. And they have a rule that a governor can't have any other job at all. So I just volunteer as a physician since.
Josh, what drew you originally to emergency medicine in rural Hawaii, and how did that shape your clinical philosophy? You're not from the state originally, right?
No, I was born in upstate New York, and then I grew up in Pennsylvania, did my med school at Penn State and residency at Pitt. So I was really a Pennsylvania guy.
Yeah.
Two things happened, or maybe three. So I was lucky enough to get a National Health Service Corps scholarship to repay my debt. I trained in family medicine and done a ton of ER from the first day of second year residency on. So that was a passion. And I ended up with the National Health Service getting placed in Hawaii. Normally, a guy like me would probably get placed in Philadelphia or New York or Pittsburgh.
Yeah.
But that particular year, back in 2000, there just weren't really any extra spaces. And against all odds, I ended up getting selected to go to the Big Island of Hawaii, where I became the rural doc for about 8,000 patients in a community health center. And of course, because I love covering the ER, I did that also to, save money and to serve and to just be the doc in the weekends and after hours. So I had that experience, and it was really quite extraordinary to get sent to a faraway place and to become the physician. I highly recommend service if people have, the chance to do it, whether it's for 6 weeks or 6 years or 60 years. I mean, it's a special thing. Your community really values you, and everything that we do as physicians has value, admittedly. But when you're in public service and you're off in a place that has no other healthcare provider, it's pretty special. And so people welcome me, and I became the doc, and a lot of different things happened that ultimately led me into public office also. But it was really my base and core experience as a physician that kind of set everything else into motion.
It sounds like there's some correlations between what drove you into medicine and then probably made you continue working in public service as well.
Doing the National Health Service as a part of that commitment as a physician. And I started seeing a different kind of struggle and suffering in society. People had no access to trauma services or behavioral health services, where I was, like nothing, no drug treatment, no mental health care. And I was frustrated and worried about the community. So I told people about it, and they said, well, look, why don't you also run for office if you see those problems and you feel passionate about it? I think they were kind of kidding. And I said, all right, I'll do it.
They just wanted you to stop complaining eventually.
That is right. And I can really complain when I see something that's rotten. So, so I ran for office, going door to door in my scrubs, the southern part of the Big Island and Kona. And sure as you would expect something weird to happen, like it happens in our ERs or in our lives, it turned out my opponent was a convicted coke dealer, and I ended up getting elected. And so now I was a state representative and a physician, and that kind of sealed it for me because I then could focus completely on emergency medicine on the weekends. So I worked basically every weekend for like 18 years till I became governor. And during the week, I would go back and be a state legislator.
That's incredible. Josh, you continue to practice. How does that influence governing and how you decide what priorities are? And
we figure out how to deal with problems in the moment, and that's a skill set, right, that you develop. For me, almost all of my experiences in the ER inform continuously what I do as governor or what I did as lieutenant governor. There's just kind of two ways that this has worked. One, for disasters and crises, obviously the emergency room work has been indispensable because we've had several huge incidents or episodes that I could share with you. There's the Maui wildfire, which occurred almost exactly 2 years ago. That was devastating. We lost 102 beautiful people, and the entire community was destroyed. Over 4,000 structures, and it made essentially 8,000 people homeless, which we had to house, and everyone had health needs. And so being an emergency room doc, I could respond right away. It's just in our DNA now. And that helped. So we housed everybody immediately. Within 13 days, we got everyone into a hotel room for a year. And then we built houses and, set up free clinics and the whole thing. So that, I think, helped a lot to be able to make decisions fast. So I will admit I use emergency powers kind of frequently, and it's part and parcel of the emergency work as a doc. People in Hawaii are not too surprised that the emergency room physician uses emergency powers just because I want it done, right? So there's that. And then the other stuff, the longer play was, I was continuously seeing people suffer in the ER. Either they weren't getting access to, say, behavioral health treatment if their child, say, was on the spectrum and deserved care. And so I went and passed a bill to make sure that everybody who had a child with autism got coverage for life. Or another example was, for some reason, we weren't covering advanced head and neck surgeries for kids with cleft palate. And we just had to, fight it out a little bit with the lobbyists and the insurers. And over time, through relationships with families that had these beautiful children that had a lot of difficulty getting their surgeries, we made the point that you have to care for people. And then the final example was housing. And now I know housing doesn't strike a lot of people as a healthcare concern, but it is, especially if someone is unsheltered and is homeless, because in our state, and really every state in the country, an unsheltered individual will live 3 decades less because of infections, trauma, going in and out of the ER, 9 to 12 times a year instead of 1 to 2 times a year, that kind of thing that we deal with. And so I just viewed housing as healthcare. And after seeing the same individuals over and over and over again in our ER, I just felt that it was a much better use of everyone's energy and resources to find a solution. So we built tiny houses in villages in Hawaii. And what we're seeing is harm reduction. We see people use and abuse substances far less, alcohol far less in 1 month. They don't go back to the hospital almost at all when they have a roof over their head. What we've also noticed is all of their chronic disease indicators improve, and their cost drops from about $80,000 per person per year down closer to $25,000 per person per year, because they're just not stuck in this kind of cycle that we have all become very familiar with, which is in and out of the healthcare system when you don't need to be. And I think this is very likely to become a national solution if people decide to listen to what I'm preaching on this one. And it's not a red state or blue state problem. It's like a whole country problem. So I'm very keen on making sure that people see it through the perspective that I've had to experience it, which is as an ER doc, watching people suffer and struggle and seeing that you can really do better if you just provide a kind of a sensible solution. So that's another one that's been very important to me as governor.
Hey doctors, AI isn't coming, it's already here. Whether it's scribes, risk prediction, or chatbots, AI is reshaping medicine right now. And that's exactly why I created the AI Secrets for Clinicians webinar. Along with my friend and Valdar Health founder, Dr. Sarah Gebauer, we compiled a practical guide featuring a roundup of the best tools, prompting tips, and educational resources for all clinicians to get started with AI. This is the starting point. You need to learn how to use AI safely, ask the right questions, and take the lead on incorporating this new technology into your practice. Visit offcall.com/AI guide. That's offcall.com/AIGUIDE to get started. Thanks. Josh, you made me think of two things. One, I wonder if practicing in Hawaii on the Big Island has made you way more attuned to the limited resources that you have available. And then number two, I wonder if that same remoteness makes Hawaii a great test bed for fixing this problem. If you can show that, hey, this works in Hawaii where we do have limited resources, one could argue that this should probably work on the mainland as well.
Yeah, I think that's correct. We have a severe provider shortage here in Hawaii. And so that combined with a real difficult time building housing does suggest that if we can get better outcomes in a closed system, it is translatable everywhere. And there are a lot of remote parts of the country, maybe not as geographically remote as Hawaii, which, by the way, is the most remote geographic isolated place on the planet. I mean, it's 3,000 miles in either direction where there's nothing but ocean. So that's a real challenge. But for sure, we've had a very high number of individuals that are unsheltered homeless because people come to the climate here where they can survive, and we care for them, but we use our resources thoughtfully. And just the fact that our ER was being utilized about 30% of the individuals in the ER were homeless individuals. That was not sustainable because there just weren't enough beds for people with heart attacks and complications from their cancer and traumatic injuries and so on. So we had to be smarter about our resources, and this is one way to do it. Utilization is way down amongst vulnerable people when we have a village for them to live in. So that's a good thing. And then in an interesting way, we are able to test all of our kind of different theories about how to actually care for individuals who are unsheltered and struggling, because it's a closed system. Once you're in Hawaii, you can't just drive over to another state and seek help or relocate. I mean, you're pretty much here. So we really get to know our people. And I personally see, when I go out for my run every morning, I see individuals that are still on the street and people who are maybe living in their village, but spending some time back on the street seeing friends. And they know me because I'm walking around in my scrubs still when it's not work hours. And it's a very small community. So I'm able to talk to people and say, okay, how are you doing? A lot of them are, they've gone through tough times. There's a lot of bipolar disorder and schizophrenia on the street. And we really focus on harm reduction without judging. And I think overall, I'm able to carry that message. I'm going to be the chairperson of the Western Governors Association coming up, and I'm headed into the executive division of the National Governors Association. And usually what I do is I just talk about healthcare. That way I don't scare one party or another. I just talk about, look, I have my ideologies, which are a touch left of center. And, I believe in healthcare for all, that kind of concept. But I am able to usually convey it in terms that both parties can understand. And I'm hopeful that this could be one of the things that unite people, because every governor struggles with decreased resources or shortage of resources, like you are correct to assume. And as we head into this next part of the healthcare era, where we could see some really significant compression of Medicaid resources, we could see rural facilities challenged to survive. We're going to have to be smart about what resources we do come up with. So I'm optimistic people will take me up on this.
Josh, we spend so much time focusing on the federal government and CMS and Medicare and Medicaid services. We spend very little time hearing about the state level interventions when you think about it, ultimately the states are more responsible for their citizens than the federal government is of any one of us. You mentioned, building housing. Are there other innovations due to either Hawaii's geography or just your scrappiness that you feel like we should be bringing to the rest of healthcare in the U.S.?
In 1974, so a long time ago, 51 years ago, the people that, long preceded me passed a bill called the Prepaid Health Act in Hawaii, which means that if you work half time or more, you get health insurance. That's it. And that has put us in a place where almost everyone's covered all the time. And almost all docs, nurse practitioners, and so on, hospitals are reimbursed all the time. So there's at least two things worth mentioning here. One is that Hawaii is considered the health state, and we have the longest lived population, like by 3 years. So our lifespan is much longer. Now, you could attribute that to a lot. Sometimes people say, well, it's sunny and everyone's healthy. But also our Hawaiian community struggles a lot, and they suffer chronic disease and mortality rates about a decade earlier. So that balances out. But we are healthier because people are covered. And that is one way to go about things. And it's pretty prudent, because also worth mentioning is our healthcare costs are the lowest in the country. Our Medicare costs are the lowest. And it's because we don't have as many people utilizing end-of-life care. Not nearly as many individuals end up getting cardiothoracic surgery or really complicated cancers in some cases, because we do a lot of prevention because you're covered. You can get your testing done if you want to go get it. We all know that some people choose not to, or they can't find a doc, but we do better on a lot of these things. And so there are lessons to be learned. And I'll tell you, I worked all those years in rural ERs, in critical access hospitals. So not one day of my entire practice life did I have access to a CT scan or MRI. Not one day. I mean, I have to transfer people an hour to get that. So I never personally in my career, once I was done with residency, right, got to order a CT scan, MRI, or set someone up for a catheterization, a cardiac cath. So my personal spend was all based on a stethoscope and plain films and regular labs and diagnostic acumen, because I had a lot of great mentors. And so I had to, rely on, my intellect and training. And yeah, of course, I transferred plenty of people if they had, a dissecting aortic aneurysm or whatever, but I had to diagnose it. I didn't have the benefit of, as much as I might have liked to, those things. And so, in the end, I was always a super outlier, because people say, well, how on earth can, the per patient cost be so low in these areas where, in this case, it was me and a few other colleagues were practicing. And it was just that. We were forced to do with what we had. We knew our patients very well. So I knew when someone was much more likely having a panic attack rather than getting a cath. Or I knew when someone needed to rest in the hospital on a 24-hour OBS rather than going back into the community and stabbing somebody, So you really get to know certain things. And that was, I think, beneficial.
It makes me almost wonder if, healthcare just takes up the volume of the container in which it's placed. If you have fewer resources, you're going to still figure out how to make it work with less technology, less expensive care, and you're probably investing heavier in getting to know the people, to know, oh my gosh, Mr. Jones looks way worse today than he normally looks. I think we really probably this time should hospitalize him or something like that.
And by the same token, I would spend whatever amount of time and energy was necessary that I could possibly spend with the patient to help them with what I had. But the good news is their outcomes were the same. So they didn't suffer. In fact, I think probably people tend to do better when there's more human contact, when they have a good healthcare provider or a good healthcare team. Because as you know, a ton of what we do is interpersonal reassurance, expectation management, and of course, sometimes a serious surgery. I mean, no doubt. But those are the rarer cases when someone has something unbelievable to deal with. I mean, I had my share of those because a lot of people, having not had healthcare for years or even decades, would come walking into the clinic or the ER in the rural area, and they would have some unbelievable tumor that was now like obstructing their ureter, and they were in renal failure, and it could have been dealt with, and they needed a lot of care. And in those cases, of course, I would get them to the tertiary hospital, and I would do whatever we could.
Josh, I want to ask you what your ER work maybe taught you about politics. We talked a little bit earlier that you sometimes use emergency declarations because you're an emergency physician, and I get the sense that ER doctors are good at kind of cutting through the noise. Do you? You seem like a pretty relaxed guy. Does the pace of change or of the negotiation and the slowness of politics irritates you sometimes as an emergency physician who's like, guys, this is what we need to do. This person needs whatever, antibiotics or surgery, or, are you able to remain resolute and calm, or does it irritate you as somebody who kind of sees what needs to get done?
I do sometimes get restless. A lot of times
that's a nicer way of saying it. Yeah.
Yeah. It's a lot of times if there's like month after month after month of discussions going on and they're not getting to a solution, that's when I ask people to bring me in and I say, in the next hour, we're going to look at all the data and we're going to make a decision. And if the decision needs to be adjusted later, we'll adjust, which is very much an ER doc approach.
It almost sounds like, hey, let's get both the consultants, let's get medicine and surgery to come down to the bedside and let's talk through it together.
That's right. And then And the very nature of emergencies or, issues in society that have become emergencies, like the housing situation is a crisis in a lot of places, or access to a hospital is a crisis if it might be closing. It needs action. So that has helped me anyway. I do get distracted quite easily if stuff just lingers. So I'm always doing a couple things. I think that might drive other people a little crazy, but that's how I am. And in my term, we've been, serving now for 2.5 years, in the governorship, and I did 4 years as lieutenant governor. We've done a lot of super big things that had been discussed for decades. And finally, I just said, we're doing it. It's not political. As you know, in the ER, you can have someone come in that's very, very conservative or very, very liberal or whatever, but they're all hurting. That's the common denominator is fear or struggling and suffering. So I see everyone the same, essentially, and I just try to get to a solution. And that's on each of the issues, access to healthcare, homeless solutions, our housing crisis. We have serious shortage. So we are under emergency rules for housing and homelessness. And I admittedly cut some red tape and some of the nonsense that I just thought. Think of the bureaucratic background and nonsense in government, like the prior auth problem in medicine, where you say, I know eventually I'm going to get to prescribe, this, this proton pump inhibitor or something like that, but they're going to make me go through, A, B, C, and D drugs that are definitely not working well enough. And then I'll be allowed to use, the newest drug that I know actually this patient needs. Well, that's kind of what it's like as governor sometimes, where people say they have to go through process A, B, C, and D. When we know that we have to build some housing in a community, we're going to do it. But by delaying 3 years, it makes it more expensive. Does that sound similar to medicine? By delaying 3 years, we have more complications in the community because more people get up in arms. That seems very similar to me. If we delay care for somebody and God forbid their cancer spreads or their disease worsens. So there are a lot of parallels, actually. And I go right for the cure when I can. And what I tell people is, if we deal with the problem sooner, successfully, even if it's a little more costly, even if I've cut through some of the nonsense, we are trusting that the cure is what's necessary. And we're also trusting that that time is very valuable, which it is. Time is very, very valuable in government because delays and waste, they can really be a drag. So I see these things that way, and that's out of the ordinary or normal processes for almost all of the political colleagues I have. So it's just like what, you gotta be kidding me, and admittedly you can make a mistake here or there, but at least you have time to correct it. So I take all the data I can. I don't do it blind, and then we go.
Josh, I've always thought of practicing individual medicine and the practice or the delivery of public health as very different, almost diametrically opposed. But you're the first person that almost makes it sound like there are a lot of parallels between prevention. Hey, let's get your lipids under control, and hey, let's prevent things by keeping people housed or helping keep them healthy so they don't end up in the hospital with DKA. If we get them their insulin, we won't end up with DKA, which is 10 times more expensive to treat.
Yeah, well, think about this. Like if we address, so climate change is a big deal in Hawaii, right? Because sea level rise is serious when you're completely surrounded by the sea,
and you're seeing it. It's not a made up concept or a future state. You guys are already starting to see this.
Yeah, absolutely. Oh, we're getting hammered by climate change, and the wildfire was definitely impacted because we had 80-mile-per-hour winds that took the fire down the mountain and spread faster than you could possibly, face it. Even with the heroes that our firefighters are, and the medics and the docs and everyone. So for us, putting in preventive measures, we have tons now of resources because of the climate impact fee that I sponsored and we passed, and we talk about that if you want. But the monies that we put up front with extra fire breaks, extra fire trucks, having a fire marshal and so on, means that the next fire won't occur or won't occur nearly as badly. And that's very much like, making sure people's hemoglobin A1C and lipids are fine so they don't have a big heart attack. I mean, again, it's quite obvious the parallels. And sadly, we had to have that huge fire before people finally listened. I had been proposing this kind of thing for years, but it didn't resonate fully with other elected officials until we suffered this $13 billion, 102 casualty disaster. And I'm trying to tell the rest of the world, listen and see, learn from the incident that we went through, which was utterly heartbreaking, so that you don't have to go through it. Some people don't want to acknowledge sea level rise or extra challenges to the environment because they think it's some kind of like sign of weakness or a concession that there actually is climate change from fossil fuel consumption. Well, let's just get over that. And, let's deal with what challenges we have. We do have these challenges with potential flooding. We do have these superstorms that are causing hurricanes or spreading wildfires. So whatever the cause was, the circumstance remains that we need to be, thoughtful and prevent some of the future harm. So that is really the way to approach it. I'm lucky to be a governor, in real time now to share what I've experienced.
Josh, I want to talk about physicians serving in public office. Maybe can you tell us a little bit about your role in the 314 Action Initiative and why this matters to you? You've sold me, but why should other physicians step up and say, I think I've got to do this, I've got to run for office, whether it's their local school board or it's their local Senate or their governorship or a federal role?
Well, look, I'm super enthusiastic about, the mission that 314 and I have taken up together. And Save Our Care is another good group. It's pretty basic. The experiences I've expressed today about being able to provide some thoughtful leadership based on our experience with our patients, which are also called constituents, I think it probably leads to more connected, compassionate leadership. Also, it's a lot harder to make like these kind of cuts that we're seeing to what keeps people alive or secure when you actually have had to care for them when they're insecure.
Oh, that's a great, that's such a great point. Yeah.
So it's just a very real experience. And we would like to get 100 physician or nurse practitioners or nurses elected, social workers, anybody that's touched healthcare in the coming years, because They will drive the dialogue. It'll be more supportive of our healthcare system in general. It'll probably create a much better system where there's less nonsense and more real care, and again, I'm trying to be nice because I don't want to just pound on big businesses or corporations. I mean, I value them in different times and different ways also, but I value a nurse or a family doc or an ER doc a lot more, okay, in the context of caring for a human being. And that's why we want to elect, healthcare providers. And it's promising. If people are watching you today, have them go to 314. It's PI, that's why they picked that name. It's the science base. It's not even just doctors.
Yeah, it's like STEM.
Yeah, STEM type people, right? And these tend to be very thoughtful, pretty well-educated individuals. They're going to make good leaders if we put them into it. And, as I shared with you earlier in the podcast, I got in an unusual way. I was really just trying to make a point that we ought to get healthcare for people in rural areas and give them mental health care and drug treatment. And then when I won, I found myself kind of getting a PhD in public policy. But there was only one doctor that I knew that had done that before me, and that was Howard Dean. And I got so lucky, just like 314, we're sponsoring, this huge cohort of these wonderful candidates. But I had the luck of getting named to one of Dean's list, the Dean dozen, his first dozen, just totally random. I mean, he saw a young doctor running for state representative and he endorsed me. And it wasn't about money. I didn't raise any money because of it or anything. It was just an honor to be noticed by Howard. And he's now like a personal friend. After all these years, he's like an uncle to me, right? And I watched what he did, and he kind of smiles now because I started as state rep, and then I became state senator, then I became lieutenant governor, kept working at his advice, which I would do anyway, but I would definitely follow his advice because, Howard's grumpy, and so you got to listen to him. And then became governor, and it's just shocking, really. And I became governor because of the health challenges that we had during COVID. So getting 314 up and going in a huge way is valuable. So if people would be generous enough to support it with some resources, it's great. And I'm going to do that. I started a PAC called Heal America. So it's the healamericapac.com. And we're going to give hunks of our money over to that same cause so that docs can get elected. And it's really not about, red state versus blue state or whatever. It does play out that way a little bit, probably a little more tilting towards humanitarian type people because they are physicians and nurses after all. But it's meant to put good people into office so that we can weather these eras where people are maybe not quite so good and passing bills that frankly are somewhat more like torture than they are legislation. So I think that's the way.
Dr. Green, if you could give one piece of advice to a doctor that's considering public office, what do you think that'd be?
I would say absolutely let people see you as a physician and don't be shy about it. I literally walk door to door in my scrubs, literally. First of all, they're comfortable and they can hold your iPhone, right? And second, then people see you and they should see you for who you are. And I think also from a practical standpoint, it's an incredible advantage to be thought of as a healer or as a person who cares about their community. We always felt it was, an advantage of about 5 to 10 percentage points more because it cuts through a lot of the BS, right? You've already been vetted by your peers. You've been vetted to not be a moron, so you had to at least do something okay. So that scrub or that doctor in front of your name really conveys a whole lot more than you might think instantaneously. Just being a physician absolutely sets one apart, and it's almost always in a positive way.
We as physicians are so we take it for granted almost. I don't think we fully recognize all of the skills that medical training give you, whether it's like you said, like dedication to a cause that may take you 15 years to get to the end of and see the road to being an attending, or it's the ability to gain rapport rapidly or to communicate with people who are similar or different from you. I mean, I think those are all extremely powerful things that we learn while we're learning that's the art of medicine piece that we're learning while we're learning how to read an EKG.
It's totally true. There are a lot of advantages that come from, our medical training. One is assessing problems, okay? That's a big deal. By the time I was running for my second term as a state senator, or I think one year I called 16,000 people or something. Remember, I was so used to taking a history from people that within 3 or 4 syllables, I could, know fairly well whether they were favorable or not favorable as a vote, or a person that would be receptive to what I was dealing with, or maybe it wasn't the right time. I mean, it got weird. And I sometimes would let my wife, Jamie, listen to this. And she's like, how on earth can you know by the second word whether or not that person is going to later in the conversation? I would show her, I'd check off a box whether they were likely to be a friend or a foe. And it would freak her out because it was just incredible, I think, to see and hear that. And it's just like, it's like anything else, you know how some people like in the NBA say you got to take 10,000 shots to be an expert. You learn to hit your threes, or a golfer, has to have 10,000 strokes. Well, when you've had 10,000 encounters with individuals that are going through a big challenge, you know whether or not they have needs, and those needs can be then dealt with. So it's a huge advantage if you have spent a few years in practice.
Josh, in our final minutes here, I'm a clinical informaticist and an AI kind of thought leader. Can you tell me a little bit about early results from pilots of AI in healthcare in Hawaii?
I wish I could tell you more because I'm so excited to see it happen. And I've only now begun to tell my team this is where a big part of the future is going.
Yeah.
We have historically had about a 22% healthcare provider shortage. It's dropping in Hawaii because we're paying down everyone's loans as part of our, our HELP program, which is Health Education Loan Forgiveness Program. But we still have an incredible shortage of hours to provide care for patients. And I'm convinced that if AI is used well, it will offer us a lot of solutions. And I don't shy away from that. In government, my workforce is 30% short. In healthcare, my workforce was 22% short. So the answer is we're short. And we have to acknowledge that technology, if used well, could make a huge difference. Now, we're still going to need the ER doc to be there when someone is cut off 3 of their fingers. That's not going to be solved by anything else. But we also are going to be able probably to help people get more efficient care and to get reminders that their prevention, if done now, will decrease their risk by 85% of having a heart attack in the next 10 years, and get your blood test, and we'll see you on the other side of the test to talk about it. I mean, that kind of stuff is going to be incredible. And it can't come soon enough as far as I'm concerned. A lot of people feel the sky might be falling from the recent piece of legislation, and admittedly, some pretty horrible stuff is in there. But I did press hard for $50 billion to go additionally into rural health. And some of the, I worked with Dr. Oz, and we were spending some time together. And the truth is that money can be used in a lot of ways, including for tech and prevention and chronic disease management, in addition to shoring up our rural hospitals. And so a full half of that money will go equally to each state. And I'm going to spend some time in the coming weeks talking to Oz. And believe it or not, I'm told the Secretary of Health, we're probably going to get together and talk about some of these that we're going to differ on. For sure, we're going to differ on vaccinations and issues like that. We will talk about these other possibilities. And so there could be some silver linings out there. And we as physicians have to press for those silver linings. We really have to continue to be positive souls for our patients and our constituents. And if we are, believe me, we're going to win out in the end. So whether you're on a committee, you're an expert in your field and you're providing advice and testimony, or even running for Senate or President of the United States, I mean, do these things because we'll come out better.
Well, Josh, I just have to say thanks for supporting the rural health centers. I'm from Kansas originally, have family that live in rural Kansas, and so I'm particularly worried about rural care. And then, my other reaction is just necessity is the mother of invention. And like we've talked about with your housing initiatives, I mean, maybe Hawaii is the microcosm showing how AI can be successfully leveraged to turn shortages into surplus and allowing more resources to go where they really need to go because AI is able to optimize and make care more efficient too. So thank you.
Very well said. That's our dream. And if people want to learn more about who we are, follow us. My Twitter is like at Governor Josh Green MD, or Facebook's at Gov Josh Green. I mean, it's not rocket science, right? Just follow the stuff and maybe we'll all collaborate and find some good solutions. But the future can be bright if we don't take each other apart along the way.
Well said. Governor Josh Green, thank you so much for the time, for talking with me today. It's absolutely been a pleasure. And, just one ER doctor to another, it's really inspiring to see a colleague making such a difference. So thank you.
Thank you, Graham. Appreciate you.
Thanks for joining me today. For interviews with physicians creating meaningful change, check out offcall.com/podcast. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.